To me, they changed the paradigm from it being a bladder disease to the
Yes.
bladder's just a target. of the
Exactly.
disease, right?
Yeah,
Yeah,
exactly.
it's a big paradigm shift.
Yeah.
But I get that. My question is, why is the bladder a target? So why is not the because the cats are
Well,
so sensitive to
it's-
any other.
It's not
infectious
exclusively the bladder.
Welcome to the Purr podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kuppenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Dr. Susan Little.
And Dr. Jolle Kuppenstein, this is the Purr podcast.
Now that it was markedly better, don't you think?
Way better than the last time.
Yeah, thank you,
Right.
which is a low
Right.
bar. I understand.
Right.
I chronically have trouble with intros.
Yeah, I do
Yeah,
too.
it's
Don't
a
worry.
timing
Yes.
thing.
Yeah.
It takes
Me
a
too.
mountain.
He starts
takes
it
a
when I'm not
mountain.
ready and I look like a deer caught in the headlights and then
Every time.
it's all your fault,
I
Yola.
understand.
Yes.
All your
So,
fault.
so we have a wonderful guest. Maybe you can introduce yourself.
Yeah, sure. My name's Allison Kendall. I am a clinical, now as actually associate professor of internal medicine at North Carolina State University. And then I mostly though am in nephrology, urology. So we have a nice little nephrology, urology group at NC State. And I am transitioning actually out of internal medicine to just doing nephrology, urology now.
Cool. Cool.
Yeah.
Lots
Yeah.
of topics to talk about then.
Yeah.
Hey.
Lots of pee.
Right. Right.
Who doesn't like pee?
Yeah.
Right.
Yeah.
Right. And just to explain,
Yeah.
during the podcast, we only talk about cats. So that's a little bit of the
Yeah.
rule. No D words, please, because that's the lesser species for us, and we really want to focus on the super species.
Yeah.
the
Well, all
cat.
my research is in cats too, so I'm perfect.
You're
I
made
love
for this
cats.
podcast,
Yeah.
so this is
Love
wonderful.
cats. Yeah.
Perfect. So can you tell us a little bit about your background? I mean, I know you work at NC State, but how did it all start? Your love for cats and pee.
Yeah. Actually, yeah. It's like a weird. I went to vet school at Colorado State University, and at that time, I had no real interest in being an internist, and actually, didn't even nephrology, urology was not on my radar
Right.
really at all. I actually really wanted to be an emergency vet. That was my whole goal, was to do ER. Really liked ER and like the trauma of it. And
It is traumatic.
It
That
is.
is for sure.
Yeah.
Right.
Yeah, and I think I started to realize the things that maybe I didn't like in vet school, which was kind of the opposite, I feel like, for most specialists, where they decide like what specialty they like and then they go for that. For me, it was almost the opposite in that.
Don't tell me surgery.
Yeah, I hated. Yeah.
Oh,
Well,
Finally.
Yeah.
Finally.
Yeah,
It's
well,
done.
I had a terrible experience on my surgery rotation. Not for anyone at CSU, they were great. But me, so I went to do a scrotal ablation on a dog
Right.
as a fourth year student. And I did not realize that when you had to do that, you had to leave at least some of the scrotum, so for swelling and to close.
Okay.
And so I took it all off and ended up with a pretty gaping hole on the dog to where a surgery resident then had to scrub in and do all of these walking sutures, and they ended up having to do a skin graft on the dog. And it was in that moment where I was like, I cannot be a surgeon.
Yeah, so you had you were
Yeah.
in the split of this highway. Either you become an oncologic surgeon, because that's exactly what you need to do.
Yeah, exactly. Take it all.
Big
Yeah.
holes, or do internal medicine.
Yeah.
Sadly,
Yes.
you took the wrong path.
Okay,
For the rest,
yeah.
it's okay.
Yeah,
Right.
well, I realized then that I didn't want to do surgery. And then I was also, when we did our dentistry lab, was the only student in my lab that broke the cat's jaw. Okay, so
Oops.
then I realized I can't do surgery and I can't be a dentist.
What's
So
left?
I can't go into general practice. So then I want to do emergency. But then it was during my internship that I fell in love with internal medicine.
Right.
So, but I at least knew what I
think
couldn't do.
the other thing is during your internship, you kind of, start hating emergency service. I don't know if that's
Yes,
the same way
yes,
with you, but
yes.
that was with me because
Yes.
I was kind of like, oh, emergency service is pretty fun. But then I remember when I was in Georgia during my internship, the lady that governed the ICU at night, oh my God, she was so awful that it just turned me off on emergencies duty forever.
Yeah.
So I said, okay, check. I'm not going to do
Yes.
that one
Yeah.
for sure.
Yeah. So I
Right.
think I guess, yeah, it's just knowing your limitations, right? Like I ended up, instead of knowing what I wanted to do,
Right.
I just found out what I couldn't do.
Right.
And
So
then
you have a
went that
list
way.
of differential diagnoses and
Yes.
you ruled them out.
I
so,
did. Yeah.
right?
Like surgery, no,
Yeah.
not this one, not this one. And then, during my internship, really was still focused on emergency. And then just realized that emergency wasn't it wasn't the exciting trauma that I thought it was going to be. I thought everything was going to be like bleeding out and hit by a car and
right,
everything
yeah.
was just like itching or scooting its butt. So
Right.
I decided
And then
to
for a
that
long
one
time,
too.
It's not extended.
Yeah.
surgery.
Yeah.
It's funny how things aren't what you think they are.
That's
Right.
Right?
Yeah.
Right.
Yes.
So my soon-to-be son-in-law is a surgeon on the human side,
Mhm.
and he's doing I guess a type of externship right now. He's in his residency, and he's staying with us because it's a hospital near our house. So when he comes home, I say, "So what was exciting today,
Mhm.
John?" And he's like, "Gallbladders," and then the next day, gallbladders. Like
Mhm.
I had this total misconception.
Yeah.
Apparently, they do a lot of gallbladder
Wow.
surgery.
Yeah. I
Yeah,
didn't know
number
that
2 is
either.
hernias, just
Yeah.
in case you're interested.
Yeah.
Right.
Yeah, so I'm like, okay, I
right.
don't think I could sign up for a lifetime of gallbladders and
Yeah.
hernias, really. But
Yeah.
But I think
Yeah.
internships are so good because you rotate through all these different, and
do.
you learn during your internship the things that you really like and the things that you really
Yeah.
hate. So
And the stuff that you think that you like as a student becomes very different when you're the primary clinician, you're the one doing the owner communication, then you're like, oh, actually,
Yeah.
like I don't like talking to this drunk guy at 2 a.m. about his dog that's itching. So
Right. That's true. I wish that there would have been a very wise person that told me you should have become a radiologist. Because they offered me a radiology position, and I was stupid enough to say no, I don't want it because I don't like to be in the dark.
Yeah.
My radiology friend right now is in Hawaii doing teleradiology for
Yes.
2
And he-
hours.
he doesn't have to
Yes.
speak to
And
anybody.
he doesn't speak to anybody. And he's just in
Yeah.
the sunshine. It's not fun.
I know. I think that too. I think I went through every specialty learning which one I was going to fail at and ended up on internal medicine. And sometimes I look back, I'm like, I think I should have failed at medicine.
Right.
So then, cause what would have been next? Like not being an
Imaging.
internist. Yeah. Like in imaging
Yeah.
or
Right.
Yeah.
right.
something else.
Yeah.
We
So
all make mistakes.
Yeah.
In life.
yeah.
But, okay, so then you became an internal medicine, but then
Yes.
where did you land into the world of
Urinary.
Mm.
Yeah. So then I went and did I stayed actually at Purdue for my residency where I did my internship. And actually at that point still I did not really like urinary. But what I did really like was procedures. And that's what made me go into internal medicine, honestly,
Right.
was I really liked any sort of endoscopy.
You're a woman
So
after
that
my
could be-
own heart. I don't want to do surgery, but I like procedures.
Yes. Yeah.
I like tubes and sticking things in
Same.
and
Yeah. I like to be on the inside of the organ, I guess. But yeah, I liked more of the procedures. I knew like that was kind of what I wanted to do. And then one of our mentors at Purdue, Larry Adams, who's a big urinary guy,
Oh my gosh.
and just he's such a good mentor because he was like everyone's dad and
Right.
just like really mentored me during the end of my residency. But then at that point was like I really enjoyed the urinary procedures, but I liked all minimally invasive. And so actually when I went and got hired at NC State, it was to do interventional radiology.
Right.
And then I was going to bring IR and minimally invasive to NC State. But then shortly after getting to NC State, became really close friends and mentee of Shelley Vaden.
yes.
Right.
And then we kind of hooked up together and we became such a good team. And she kind of was such a good mentor to me that then, the procedures just kind of transitioned into urinary. But honestly, I mean, most of the interventional procedures in internal medicine end up being urinary.
Right.
So it kind of naturally morphed that
Right.
direction.
And we're going there for sure. I just want to step back to the fact that if you have a mentor like Larry Adams or Jody Lewis, you cannot do anything else with urinary.
Yes,
Don't you think?
yeah,
I mean,
yeah.
they are so inspirational.
Yes, and they're
you know,
so excited about it that it rubs
Exactly.
off on you.
The
Yeah,
passion does.
Exactly,
Yes.
exactly. And
Yeah.
though Jody doesn't like surgeons, at least for urinary.
yeah.
We have such a wonderful relationship together,
Yeah.
and he's such an inspiration that you almost start to love that part. But
Yeah.
Yeah.
so I just wanted to say that because I think
But it plays a role in how interesting it is. Like for you, where you thought your journey was gonna at the start and where
Right.
Yes.
it ended up.
Right.
Yeah.
Yeah, the last podcast guest we interviewed today was York Steiner, and he has kind of a very similar story, right?
Yeah.
Involving like, he wanted to be a cow vet, didn't
yeah,
he?
he wanted to be
Yeah, and through this series of twists and turns, and they were all related to the people who influenced him at
Yeah.
certain times.
that's exactly
Yeah, yeah. And I tell the students that all the time too, just keep an open mind and
Yep.
just let it take you
Yeah, let it
where
flow.
you want it to go. Just go, just follow the path and don't dig your heels in and
right.
just let it go where you need to go.
Right.
Yep.
Yeah.
No, I love that.
Yeah.
So minimal invasive procedures in the urinary tract.
Yes.
I think that in the last 10 years, they have progressed so much in veterinary medicine.
Oh yeah. Yes.
And so from rudimentary, we stick a scope in it and we don't do anything. We
Right.
just look around. We can do so many things. Can you explain a little bit what that means for us? So we have a lot of general practitioners, especially in cats, because they're very tiny. And
Yeah.
so what can you do and what can you not do?
Yeah, cats, I certainly think cats get a little bit more challenging in what we can do, mostly just based on their size. But I do feel like we are growing still in that area. So, we can do, certainly for cats with urethral strictures, we can balloon those, we can use fluoro. The nice thing about now is that from an interventional radiology side of things, we might not be able to put a scope in a cat's urethra,
Mhm.
but we can use fluoroscopy to do a lot of these interventions just under fluoroscopy,
Right.
because we can at least put guide wires and catheters into urethras and ureters of cats.
And
So
for
I
people that are not as aware of
Mhm.
fluoroscopy, what does that mean exactly?
So fluoroscopy is just real-time imaging. So using a C-arm unit, and so it's the opposite of radiographs, and that things that are fluid turn out dark,
Right,
and then
right,
bone
reverse.
turns out light. So it's a reverse image,
Right.
but it's in real time, so we can do things with video, and so you're not having to snap shots like in radiology.
Right. And it often uses contrast medium that you
Yes.
inject. Yeah.
Yeah.
So describe how you would do a urethral stricture dilation.
Yeah, so we can inject contrast into the bladder to do a cystourethrogram, find out exactly where
Where it
the
is and-
stricture is along the length of the urethra. And then what we can do is use a really small balloon and then under fluoro position that right over the area of the stricture.
So you have equipment to deliver the balloon that's small enough to fit in the urethra.
Yes.
And do you
Yeah.
do it normal grade or
Yeah, or
retrograde?
retrograde.
We usually do it retrograde.
Oh, the kidney.
Yeah, sometimes,
okay.
and then well, I mean, honestly, you could do it either way. So if we can get a urethral catheter in them, we will we'll instill contrast that way.
Okay.
But sometimes if that stricture is distally,
Mhm.
it's really difficult. And so if we don't do it through the kidney, oftentimes we'll just do it through the bladder.
Right.
Um,
So you open up the bladder and then.
You just do it with a catheter, kind of like you were doing a
It's just a puncture,
cystocentesis.
friend.
Exactly.
Yeah,
Yeah,
okay.
and fill the bladder with
Exactly.
contrast,
Right.
and then
Okay.
express the bladder under fluoroscopy, and then
Right.
send the contrast down the urethra.
And that makes a lot of sense because I think people often think about the other species or humans where a lot of these procedures are done just by the normal way, either through the.
Well, they're retrograde. you
Yeah,
mean.
Yes.
no, the retrograde.
Retrograde,
No,
yeah.
not through the kidney, but
Yeah.
through the bladder,
Yeah.
because you can easily reach it, and then you can put in as well as you can put a scope into the
Yeah.
urethra and look at that. In cats, that's really difficult because
It is.
Right.
It's so small.
Right.
Yeah, their
It's very,
urethras are so small.
So
Right.
often people refer to either going through the kidney or through the bladder.
Right.
So,
Okay.
right.
Yeah.
Okay.
Yeah, so lots of different things that we know I feel like can offer
So-
cats.
So with that stricture, it's kind of, you're kind of doing a bouginage, really, sort of.
Yeah,
or-
kind of. Well,
right?
balloon. So bouginage uses
that's right,
shearing
it's-
force.
That's right,
to
and
open.
it's a static size, yeah.
Exactly.
Okay, so one procedure of dilation, is that enough typically?
Typically, yeah.
Okay.
Typically, just one will open it up, and then we send them home on anti-inflammatory steroids.
Okay.
Right. A rupture.
Certainly a risk.
Mhm.
We always worry about the risk of that. I've not had one happen, luckily, so we just are very cautious about size and how big we make it, and
Mhm.
that's why we do it under fluoro. So we're watching the entire time, so
Right.
we don't push it too far.
That's excellent. And then if we talk about subs, which we'll probably
Mhm.
get to it,
Yeah.
is that a technique that you do, or is that the technique that the surgeon does?
Yeah, so subs, when I was a resident with Larry Adams,
Mhm.
the internal medicine service placed a lot of the
Right,
subs. So I
right.
was trained to know how to place them.
Mhm.
But here at NC State, the surgeons do them.
Yeah, because I think it's so much nicer to do them interventionally instead of.
Yeah,
Right.
yeah.
Right.
Right.
Oh, well, we need to talk with the surgeons at
Yeah.
NC State, obviously, because
Yeah.
there is a nicer technique. You don't have to cut them open completely.
Yeah,
Or
it
do
would
they
be
do it?
nice.
Or
Well, they
use
do
it?
it all through abdominal incisions.
Yeah.
Yeah.
No,
Yeah.
no. I'm a surgeon here. I think it's better to do it the other way. So sorry, guys.
Yeah.
Anyway, perfect.
Yeah.
Yes, yes. So we lose a
Yeah.
couple of NC State very
Yeah.
yes, surgeons right now, but we have to go with the time. That's what I think.
Yeah.
But I
Yeah.
love minimal invasive stuff, so I think that
Yeah.
is fantastic that you do it that way. But,
Yeah.
great.
Mm.
Urinary disease in cats obviously is very common. If we look
Yes.
at the number of cats that are brought into general practice, urinary disease is either our number one or number two.
Mhm. Yeah.
Why is that?
Well, I mean, it depends on what urinary disease we're talking about, but FIC certainly is going to be the top of
Right.
the chart.
Right.
And FIC is actually one of my areas, my big area of research, which
Great.
I was not expecting to ever be in research of FIC, but here I am. So kind of also that like went with the flow. It just kind of I followed the path, and here
I'm
I
waiting
am.
for the
But
process. The process should be coming soon.
Yeah.
Yes, exactly. What process are we using here?
yeah.
Excellent. Yes.
Yeah, so FIC is my big research right
Right.
now at NC State. But I think there's so many things that go into FIC, and I've been to so many different behavior lectures and spoken to so many different behaviorists, and I still think probably one of the biggest reasons we have FIC is that people just aren't meeting their cat needs inside. We have so many now indoor cats and indoor only cats, and there's certainly there's so many pros obviously to keeping your cat indoors, so I don't have to talk about those. But then we're taking all these cats and putting them indoors to keep them safe and keep the environment safe, but then we're not giving them what they need with enrichment.
It's a bit of a false assumption that it is always safer for a cat to be indoors. And the reason I say
Mhm.
that is because we see obesity in indoor cats. We
Yeah.
see FIC in indoor cats.
Yes.
So there's a group of diseases that it's not that you
Mhm.
don't see them in
Yeah.
cats without
And I
their
think even
access, but
hyperthyroidism is more often in
absolutely.
indoor
So
cats.
it's a false assumption that indoors is better.
Yeah, and a lot of my FIC cat owners, I have to talk to them about creating ways to maybe they do have to go outdoors or be in a
Yeah.
patio or a backyard. Even my own, I have 2 FIC cats myself.
Of course you do.
course,
Just
yeah.
wanted to say, okay, when is that coming? But yes.
Yeah, well, I had one, and then I actually adopted one from my research project, so now I have 2.
And we
And
always say before you go further,
Yeah.
we always say you learn the most from your own cat.
oh yeah, definitely.
Right.
For being
Yes.
an owner is what you're
Yes.
doing, right?
Yes. Yeah, and
Mm.
both of those cats I've had to let outdoors. I mean, we live on a 1-acre property that's fenced in, so
Right.
we've over time, it took time, but we trained them to stay within the backyard, and they're very happy, and their clinical signs result or improve significantly. But I think if you can't do that, like people that live in an apartment building or live on a busy road or an area where it's not safe, like we at least need to be giving clients more resources for how to have a cat indoors while still meeting all their needs and their enrichment.
Right, right. And there's a lot of discussion about this. I mean, there's some people that prefer diets. There's people that prefer, only to do this. There are
Mhm.
people that prefer hydration. We really don't know exactly what is the best yet.
We don't know.
Right.
No, and I think it's a combination of everything.
Yeah, and
Yeah.
one part of it may be more important to one cat, another part to another cat. Do you know what I
Right.
mean?
Right.
So I think you have to be flexible and kind of try to design things. But I always feel with FIC patients that the cat is not my problem. It's the owner that's
Oh,
my
yeah,
problem, right?
definitely.
Because they
Yeah.
often have preconceptions and you have to spend some
Yes.
time breaking them down.
Yeah.
And they often have more cats than they should for the space. the living
Yes.
space.
Oh, yeah,
That's hard.
absolutely. Which is why I never want to do FIC research, because now I'm talking to FIC owners
I
all
know.
across the
That
country,
has to
Oh,
be.
wow.
which is not what I wanted for
Like,
my life.
kudos
But
to
it's
you,
actually
though.
really nice now, though. Yeah.
Kudos to you because it's very rarely a curable thing, right?
Right.
Most of the owners that we deal with, there's things you can't change.
Mhm.
The cat can't go outdoors, whatever it is,
Yeah.
right? Yeah, so it's like an ongoing
Yes.
work in progress.
Yeah.
Yeah.
Yeah,
So
exactly.
patience helps.
Yes.
Yeah.
Yes.
So I have to tell you that years
Yeah.
ago, one of our many clients whose cats had FIC, this client had like way too many cats. And so we brought one of the cats who is in a bit of a crisis with it at the moment. And he stayed in the hospital with us for a bit. And then it's long ago, so I can't remember exactly how the conversation went, but we ended up at the hospital, ended up adopting the cat. And I remember thinking, like, of all places for an FIC cat to live
In a clinic.
in a busy vet,
Yeah.
he did wonderful.
Yeah. Well, and sometimes I do I actually have a cat in my research study that was really struggling and belonged to a primary veterinarian, moved to be a clinic cat, and actually is doing really well.
Do you know what
Because I think they get that stimulation.
Yeah, and
Which-
it's the change of environment matters too.
Yes.
Right?
Yeah.
And I also, at least for the cat that we had, he had way more control over his life,
Yes.
right?
Yeah.
In the clinic, like he
Right.
could, we didn't have, there was no, he quickly learned which cats lived there, and most of them
Mhm.
don't live there, right? He
Right.
was the only cat. So
Yeah.
I think he got control over his life.
Yeah. Which is one of the big, when you talk to behaviorists, that is one of the biggest things that they recommend for FIC cats, is giving them some degree of control of their environment.
Mm.
And I think most owners just think that, oh, their cat just wants to lay around and be lazy all day. And I don't think all cats do. But we don't give them any sort of enrichment. People take their dogs out for walks, or they buy their dog's bones or toys, but most cat owners don't do anything for their cat. They just say that they want to lay around and cuddle all day, but
So, it's a misconception of who cats are, isn't it?
yes, yeah,
Right?
absolutely.
A lot of
Yeah.
people think they know cats, but they don't.
Right,
So
exactly.
I want to go back to we have a lot of veterinary listeners, of
Mhm.
course. And the thing that always puzzled me is the pathophysiology behind this.
Mhm.
So I know that, behavior has to do with it, but there is something going on in the body that makes these cats, getting idiopathic cystitis.
Yeah,
And the word idiopathic tells us already that we really don't know
Yeah.
what exactly is happening.
yeah,
Do we know more, or what do you think is going
no.
on? No.
I wish I did. I really do. And I've been, that's, I think also why this was not in my career card,
Right.
because then I knew people were going to start asking me to solve FIC, and I
Right.
really,
Yes,
I
please.
it's so
Hmm.
it's so challenging, because I don't really know why they, we know some stuff. We know that they have an increase in catecholamines and inflammatory mediators and cytokines released in their bladder, but why exactly that's occurring, I don't know.
Well, I think we have
so-
to give a nod of the hat too to people like Tony Buffington and Jody Westrop,
Mhm.
right?
Yes,
Who started to uncover that whole
Yes, yeah.
neuroendocrine
exactly.
side of
Yes,
it,
yeah,
right? And to me, they changed the paradigm from it being a bladder disease to
Yes.
the bladder's just a target.
Target,
of the
exactly.
disease, right?
yeah,
Yeah,
exactly.
it's a big paradigm shift.
Yeah.
But I get that. My question is, why is the bladder a target? So why is not because the cats are
Well,
so sensitive to
Mhm.
any other.
It's not
infectious thing.
exclusively the bladder.
No, but
Yeah.
it is, the cats don't die from hepatitis or pancreatitis, or most of the time the bladder is the major organ that the signs come from.
I agree, but I think also if you're not thinking about it, you're not you're not recognizing or realizing that other organs can be affected at the same time.
Yeah.
The
Yeah.
bladder's
And,
definitely the most dramatic.
yeah. And I think it's just because of the amount of pain receptors in the bladder.
Right.
But one of the things I've seen with my research is that after treating these cats now in a novel way for their FIC, is that the owners have described such a major shift in the way that the cats lay on the floor, the way that they walk around, and like these huge behavior changes that has made us also realize how much more painful these cats are than I think we ever really gave them credit for. And I think you're right. I think it's almost full body pain. I mean, they're certainly painful when they are urinating in the litter box, which gives them their clinical signs. But they also
They're painful in between.
exactly, like they even just in their sleeping position, clients have said that they sleep differently, that they walk around their house with their tail held high. So I think they're just overall painful and uncomfortable.
It's funny because we just spoke with someone else talking about pain, how cats hide their pain really
Yes.
well. But as soon as you take the pain away, people recognize the difference in behavior.
Yeah. Oh yeah, yes,
Right.
yeah.
So they
Yeah.
didn't recognize that they had pain, but they were recognizing that they did something different. And
then
suddenly you give them something against pain and suddenly, oh my gosh, that cat is completely different.
exactly.
Right.
Yeah.
So you said a novel way of treating them.
Yeah.
Do you mean something specific, or it's just novel to that cat and that
So
owner?
this is specific. So we've been treating cats the last 5 years with low dose radiation therapy.
Oh, wow.
And that has been a lot more successful than I think we ever anticipated. And that's in conjunction with environmental modification and stress control and all the other things that we know play a huge part into FIC management. The radiation is just treating the pain.
So how did that idea come about? Like, who one day said?
Yeah, so it came about from one of our radiation oncologists, and we, because we've been doing radiation therapy for pain for animals for a long time. I mean, that's the basis of treating osteosarcoma,
Right.
is you're just trying to treat the pain component. And yeah, so that came from one of our radiation oncologists, Mike Nolan, and he had approached me about it. So what do you think? Do you think it would work? Because I think, at a low dose, we could maybe we could take the pain away and bladder pain. And so let's start with FIC cats as our model and see how that goes. And so we started that about 5 years ago and have just been kind of blown away.
So you're focusing just on bladder?
Just on the entire urinary tract, so bladder and urethra.
Okay. Yeah. Okay.
Yeah.
Did they do that in humans already, or is that where did this
Yeah,
idea come from?
So they have done it in humans. The problem, like if you look at humans, they don't often do it anymore because of the concern for radiation-induced bladder cancer later on in life. But that is occurring in people. They were using much higher doses. And that was occurring much later in life.
Yeah.
And so cats, we don't anticipate
don't
are even
live
going to
long
live
enough
long
to do
enough
that. Right,
to
right.
experience that. Now we don't know for sure. But since we've been doing this project, actually we've had a lot of interest from the human side again. So I've had the CEO of the Interstitial Cystitis Foundation in Women has been contacting me. Actually, our radiation oncologist, Mike Nolan, is giving a talk about this at a human radiation oncology
That's very
convention
cool.
next month. So it's kind of re-piqued the interest in people on can they take some of this across the board.
Do you know, I like that because it's kind of coming full circle. And
Yeah.
what I mean by that is the reason that we learned anything at all about the pain receptors and the role of the brain and all of this was because cats were somewhat of a model for people, and so people like Tony Buffington could get research money, right? And now here we are,
full circle. Yeah,
I like
exactly.
that. I like that.
Yeah,
And-
Very fitting.
And
Yeah.
sadly, we're at the end of our first episode already.
Yeah.
No, it goes so fast because it's such a cool topic. But you'll be back in 2 weeks, so
Yeah.
I'm very excited. So this has been so good. Can we give a cliffhanger what we're going to talk about?
Okay, so yes, of course, we do want to talk about uroliths, but I do have more questions about the radiations.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.